So, welcome to the show, Dr. Asa Frey. Thank you for joining me.
You're welcome. My pleasure to be here.
So, am I understanding this correctly? You are joining us from Puerto Rico.
That's San Juan, Puerto Rico.
Puerto Rico, yes. I have to get that right. Great, yeah. Hopefully the weather's doing okay right now.
Right, yeah, close enough.
Yeah. So Dr. Frey, you run in Puerto Rico a residential health and education center. Is this right?
That's correct.
Okay.
We're based out of San Juan, Puerto Rico.
Based out of San Juan, Puerto Rico. And okay, so what are some of the services you provide in your clinic? Just a health center.
So our center is like you said, a residential health and education center. So our patients, it's basically an inpatient center where patients come and stay with us, and we try to address the causes of whatever their health concerns are. Typically, the patients that come and see us are people with chronic diseases. We're talking about hypertension, diabetics, certain types of cancers, autoimmune disorders, gastritis, colitis, arthritis, various skin conditions. So we see a wide range of health problems, all usually chronic in nature. And the patients come and reside with us and they undergo what's called a supervised water fasting program, which is where patients fast while they're under supervision in a controlled environment, which is also a 100% restful environment. And we watch them get better. So we supervise them. We make sure that everybody's okay and that everybody's progressing and getting the benefits that, and the progress that they want to see. And we just keep our hands off and make sure everybody's safe while they fast.
Great. And you said in a resting state. So does that mean obviously no exercise, no TV, reading, anything like that, or?
We do not promote doing exercise during fasting.
Mm-hmm.
Any sort of moderate activity is going to double your caloric utilization, so you're going to require twice or 4 times as many calories,
mm-hmm.
and that will deplete your reserves much quicker than they would be if you were resting. So we do promote things like light stretching, some yoga activity, but it really depends on the patient and their ability to do those activities. Many patients, while they're fasting, really don't have the energy or the vitality to be going outside and walking and doing stretching and yoga and things like that.
Mm-hmm.
There will be days during most patients' stays where they find that they don't really leave the bed.
Mm-hmm.
And we encourage that if they really need to rest. And we also encourage movement if movement is going to be helpful in their specific condition.
Mm-hmm.
So resting, yes, they can rest all the time if they want to. It's perfectly
mm-hmm.
fine for them to spend all day in bed. But to avoid some symptoms such as headache and back pain and neck pain and joint pain and some cramping in the muscles, and we encourage some movement during the day, whether it's just getting out of bed, walking around in the backyard, taking some sun, putting out a yoga mat, doing some light passive stretching, just to keep things moving and avoid those types of conditions. But I'm also a chiropractor,
mm-hmm.
so if people do have headache and back pain and neck pain, that tends to respond well to chiropractic care, so we use that as well.
Okay, great. And you had touched on in the beginning about kind of who you typically see. Can you dive a little deeper into the types of patients that see the greatest benefit from your care?
Of course. Well, high blood pressure patients, diabetics, type 2 diabetics, specific types of cancers, and a whole range of autoimmune diseases that's anywhere from rheumatoid arthritis to multiple sclerosis, psoriatic arthritis, pretty much any type of inflammatory arthritis. Ankylosing spondylitis also responds really well to fasting. Intestinal diseases, inflammatory bowel disease such as ulcerative colitis, gastritis, Crohn's, celiac disease, also tend to respond really well to fasting, as well as skin problems. Patients with psoriasis, acne, various types of dermatitis. And most of these patients that benefit from fasting, to some degree, have acquired or developed these conditions from an excess of usually food. Sometimes there's drug excess or there's too much exercise, but it's usually some sort of excess, and it's almost always a dietary excess. So if we can identify that the dietary excess has caused or is in part responsible for developing some of these issues, then we can kind of have an idea that those patients are going to do really well fasting.
Great.
High blood pressure patients are really an ideal patient. Someone with even advanced hypertension that's taken 2, 3, 4 medications is still going to respond really well to fasting. We can reduce the blood pressure within 2 to 3 weeks by an average of 30 to 60 points, which is about 9 times better than any medication you'll find out there. And the side effects are only positive side effects. So that type of patient, high blood pressure is the number one contributing cause of death. So chances are, if you die, part of the reason that you die is because you had high blood pressure.
Yeah.
And so if we can solve that, then a lot of those conditions down the line that people develop from the high blood pressure, they're not an issue because they don't happen anymore. The healthy people tend to live longer than sick people do.
Typically.
Typically.
So for the uninitiated who may not be aware of maybe what fasting is or why fasting might work, can you kind of break down why this approach is so effective in these particular cases?
First, mention sort of what's the difference between what actually is water fast and the difference between other types of fasting. Because fasting is extremely popular in physicians' offices and chiropractors and naturopaths and osteopaths and even health coaches, and there's 1,000 different types of intermittent fasting programs and products that people sell to obtain or sort of mimic the physiology of fasting. The difference, so we have intermittent fasting, we've got sustained fasting. Intermittent fasting is where you basically limit the feeding window during the day, so you're eating for less time, which probably means you're eating less food, and there's so many benefits for just having a longer period without eating or with eating less food. Sustained fasting, which is actually quite popular on the island, is where you take 1 or 2 or maybe 3 different types of foods and you just eat those foods and you don't eat anything else. And you do that for an extended period. One example would be potatoes and carrots. If you just ate nothing but potatoes and carrots, that would be considered your sustained fast. Some people also promote things like juice fasting, which also have certain benefits. But the main, there's also coconut water fasting, and people add lemon juice to the water, and some people do a coffee fast where they're just drinking caffeine. The difference between these other types of fasting and water fasting is, number one, is food. So with water fasting, we eliminate all food and beverages. So fasting by definition is abstinence from all food or beverages except for pure water in an environment of rest. Hopefully while you're being supervised by a physician who has experience in water-only fasting. So the number one difference there is food, and the benefits that we'll go over in a couple minutes are unique to water fasting. So some of these benefits you'll get a mild effect with other types of intermittent fasting or avoiding food for certain periods, but the benefits are exponentially greater every day that you're fasting. And that's why prolonged fasting, we see so many dramatic changes. The other major difference between these various types of fasting and what we consider to be a medically supervised water-only fasting is the presence of rest. It's very common in this health era, with everybody searching online and trying to do it yourself health programs at home. It's very common for people to try to do fasting on their own, and that's a perfectly natural thing for them to try to do. However, almost always, I'd say 99.9% of the time, rest is not involved. Either it's not enough rest or it's not the proper kind of rest. So you'll get people basically trying to do a fast, and then they go to work, and they're driving their car, and they're going to work, and they're doing everything that they think that they need to do during the day, except they're not eating, or they're only drinking caffeine, or they're only juicing. And you're going to find that you're not going to obtain a lot of benefits from doing that, just because the rest is such an important factor. So what we do here is we actually take people out of the environment that they were in before. So the environment that basically helped create their problems, right? Their psychological problems, their emotional problems, their health problems, their metabolic problems, sometimes even their problems with neurology. And we take them out of that environment and put them into a new stress-free environment without their baggage from beforehand. So, their wife doesn't come with you, your wife or husband doesn't come with you, your dog doesn't come with you, your kids don't come with you, your work doesn't come with you. You can't bring any of that baggage with you to the fasting center. And so that's what we consider to be a pure rest. Not having to do anything physically, but also not having the mental strain that we actually value that more in today's, in our society we live in. It's highly valued for you to be extremely active and to be doing so many different things, and to never take a break, and to never even slow down, even if you're really sick, right? You're never supposed to stop doing what you're doing. If you take a sick day, then people look at you like, oh, what a weakling, he took a sick day. When in reality, most of us need more time to rest.
Absolutely.
And so one of the main differences is going to be, you'll find, is rest is an incredibly huge factor.
And you had brought up intermittent fasting earlier as just something that's something that we may recommend in the clinic, something easy that people can add into their weekly lives, especially those with worries of degenerative mental health issues down the road. Have you seen a lot of success with that? This is the Neuro Wellness Podcast, so we can dive into kind of the brain effects of fasting or intermittent fasting that you've seen.
Intermittent fasting, we don't do at our center, but a lot of people can find significant benefits doing that on their own. You're gonna find that there's so many benefits just from reducing the amount of calories, the amount of time that you're spending eating. It's kind of like running. If you had a car and you drove your car for 24 hours a day, it's probably not going to last that long. But if you only drove your car for like an hour every day, and you were only, hammering that engine for like 1 hour, and then you gave it 23 hours of rest, you'll find that the car's probably going to last longer. So if we're constantly throwing food into the system and basically forcing our metabolism to digest and absorb and assimilate and eliminate everything that we put in there, and it takes about 16 to 18 hours to properly digest a meal, and every 2 hours you need a snack or you have another meal, you're basically turning that engine on and running your car, and your body's not going to last as long. You'll get degeneration in the skeletal, musculoskeletal system, but also inside the arteries and inside the neurological systems as well. Neurology, being a little bit more specific about neurology, two of the really incredible benefits we get from doing a significant period without food is something called neuroadaptation, which happens to many different systems. But what we see at the clinic is that it happens really dramatically to our taste buds. So if a lot of these patients come in and one of their main issues that has created these health problems that they have is their poor diet, and we know that changing a dietary regime is really difficult, right? It's got like a 94% success rate. Failure rate. So that means that only 6% of the people who actually want to change their diet have long-term success doing that, because it's just really difficult. It's like quitting cigarettes or getting off alcohol or cocaine or any other type of drug. So an easy way, or a really effective way of helping them have more success in changing their dietary habits is just to do 7 to 14 days on water and then return to eat again. And during that time period, they're going to develop this white frothy film all over their tongue. And underneath that film, all their taste buds are going to be regrowing and resensitizing, so that when they go back to eating what we would consider an extremely healthy but very simple diet, something that's really, really high in fruits and vegetables, which normally people have a lot of trouble eating. Now, after fasting, they can actually taste the food again. So let's say a watermelon or some celery or cucumbers or lettuce or broccoli and cauliflower, tomatoes. These foods they're full of sodium, they're full of natural sugars, they're full of minerals. And to get people to be able to taste those things is going to help them to be really successful after they leave the clinic and, throughout their life. Because most people have extremely damaged palates. They're eating salt all the time. All their food is full of oil, basically it's oil and salt and sugar and flour. And then, combined with a bunch of animal products, and that's about 93% of the calories that, westernized society intakes during the day is meat, dairy, eggs, oil, sugar, salt, and flour. And if you eat a diet like that, you will not be able to taste the natural flavors in fruits and vegetables. You just won't be able to eat them. It's funny, when we switch patients from a basically meat-based, processed food-based diet and try to prepare them for fasting. And we say, look, this is what you're going to eat. You're just going to eat fruits and vegetables. You can have a moderate amount of complex carbohydrates, a whole complex carbohydrates, and a small amount of nuts and seeds and avocado. And for about a month, they'll try to do that. But most of them can't, because the food just tastes terrible. They say, I can't eat this without salt. I can't eat my vegetables without frying them in oil. How can I be successful on a diet like this if the food just tastes terrible? And then we say, then just come in and do a fast.
Yeah.
And so after the fast, the food tastes great. They're really excited about eating again because the food tastes so good. The other really incredible thing that changes neurology-wise is their sensitivity to dopamine. Because during fasting, there's really no stimulation. So you're not, there's no caffeine and other stimulants that you can ingest. They're not smoking marijuana during the fast. They're not drinking alcohol. There's no sexual stimulation either. You're too tired, you can't do any of that. We certainly don't recommend it.
Yeah.
You're not doing exercise, so your body's basic set point or baseline for dopamine is going to reduce really significantly. And so even like really small things after fasting, you're going to be able to enjoy. Like, people actually enjoy the moments when they get out of bed. You first get out of bed, you look outside, you see the sunlight that enters your eyes. You get a little bit of dopamine stimulation from seeing the sun. They enjoy brushing their teeth. They enjoy going outside, feeling the fresh air. They enjoy drinking water.
Yeah.
And so a lot of life becomes more enjoyable, and so you find that patients are so much happier after they fast, and they don't realize why that is. But it's just because they took a break from everything.
And more appreciation for a lot of these things that we take for granted now. Yeah, like you were saying.
Yeah, you'll find that after about 2 weeks, if we see a patient come in who's really not a nice patient, and we tend not to have many people like that, but every now and again, people come in and they're very ornery, and they don't have they're not very, their manners are not good, they're not very respectful, and typically those patients are so much involved in what's going on inside their own head. So they're worried about something that happened yesterday. They're kind of, I should have done this. Or why didn't I do that? Oh, how come this person did this to me? Oh, how terrible. And they're also worried about things that are going to happen in the future, right? What am I going to eat tomorrow? I don't have any money. How am I going to make more money? And after about 10 days fasting, that patient turns into like the nicest, kindest monk that you could ever meet in your life. And they are no longer thinking about the lack of the things that they don't have, and they're no longer worried about things that happened in the past. And now when I come in the room, they're extremely nice to me. And they ask me how I'm doing, and there's some dramatic changes psychologically that happen during fasting that we get to see firsthand. So when somebody comes in and they're not really in the best of spirits, we know that we just wait about 10 days and they'll turn that around.
They'll sort themselves out, yeah.
That's right.
So obviously it's a good idea to, if anyone wanted to do a prolonged fast, to have someone like yourself to actually monitor them to make sure they're doing it in a healthy manner. My question is, do you do regular fasts yourself as a professional in this field, and what are some of the benefits that you have personally seen?
Oh, okay. Yes, I do regular fasting. I've done, since I started fasting, maybe about 10, 12 years ago, I've done maybe 6 to 8 different fasts. And they vary from just a few days to 2 weeks. And I guess I'll go into detail. So I used to have a blood pressure of about 125 over 85, which is, certainly if you go into the medical office, they're going to say, yeah, that's perfectly fine. It's not high enough for us to give you medication, because the risk of giving you the medication is higher than the risk of you not taking the medication of your blood pressure. So they're not going to give you meds, and they'll say your blood pressure is fantastic, kick you out of there. However, we know that a more normal, more healthy blood pressure is somewhere around 110 over 70, even 90 over 60, especially if we look at populations in Asia and Africa, patients eating less salty, more plant-based diet. They're going to have lower blood pressures, and they also tend to have much lower rates of cardiovascular disease, and they don't really have much hypertension. So my blood pressure used to be about 125 over 85, and I started doing these short fasts, and day, 2 days, 3 days, and my blood pressure would maybe drop like a couple points. And then I maintained that until a year later or 2 years later when I did another fast, and my blood pressure just kept every time I did a fast, it just kept on dropping until I did about a 10 to 13 day fast, and eventually I wound up with a 90/60 blood pressure.
Okay.
And that's what I have now. Mm-hmm. And as long as I maintain my healthy diet, it doesn't go anywhere. It stays right there, 90/60, and doesn't change. So that's one of the things that I've experienced.
It's pretty powerful. Yeah.
It's fantastic. Mm-hmm. Another one of the dramatic changes that I've seen with myself is that every time I fast, my eyesight improves.
Okay.
So my visual acuity actually improves during the fast, and then afterward, I have to go back to the eye doctor, and he's got to give me a new prescription so I can get new glasses. Mm-hmm. So I used to be a negative 5.75, which is not good. Mm-hmm. And now I'm a negative 4. Okay. Which is pretty dramatic, and I haven't met an eye doctor yet who's seen those types of positive changes without having surgery. Right. So that's another thing. I do it really just because I work a lot. Mm-hmm. I work hard. I do eat a very healthy diet, but mm-hmm. sometimes I don't get enough sleep, and sometimes there's more stress than I probably need or can handle in my life. Mm-hmm. And so I find it really beneficial for me to take a week or two and to escape, my life for a little bit. Mm-hmm. And instead of go on vacation, and a typical vacation is there's all this traveling involved, and you eat terrible food, and you're drinking alcohol all vacation, and you don't sleep enough because you want to make the most of your vacation. Mm-hmm. And instead of ruin my health over vacation, I go to a supervised center. One of my colleagues will monitor me during the week or two that I'm staying there, and then I'll come back to my life with more energy, with more vitality. I maintain, my skin improves every time I go and fast. I just feel so much better after fasting mm-hmm. that I couldn't imagine not doing it.
Awesome. So here's a question. Obviously there's a lot of health issues in the way that we live our daily lives, especially in America. If you could wave a magic wand and just maybe fix a few things, how would you maybe structure the standard American life to be more congruent with the types of things that you educate your patients on in your clinic, and just good advice for just about anyone?
All right. So generally speaking, mm-hmm. Before we decide if a patient is a really good candidate for fasting, we do a really detailed history. We do a physical examination. We take the appropriate laboratory tests, and we really find out, what's causing that patient's issue, mm-hmm. and see if they're going to, be a good candidate. Because some patients will not respond well to fasting, and I want everybody to have a good experience and respond well and achieve their goals. Mm-hmm. So before everybody comes and fasts, unless they've been on a really healthy diet and they've been doing, making really considerable health changes in their life, then we do sort of a preparation period. Mm-hmm. So I do it because throwing somebody into a fast who's sick and hasn't been eating well, the risk for complications are so much greater. Yeah. And that makes my job harder, and then they don't have a good experience fasting. So for about 3 to 6 months, if a patient has not been eating really well, we put them on a preparation program, and that about 90% of that is a dietary change. Mm-hmm. So the first thing we do, if they're still consuming most of their calories from animal products and processed foods, we just get rid of those. So we say, try and do as best as you can, not eating animal foods and not eating processed food and the chemicals that we utilize, that humans have created to make these processed foods are oil, salt, sugar, and flour. So we just say try and eliminate those 7 things. Get on a diet that's based in vegetables, raw vegetables, cooked vegetables, fruit, and rice, beans, and potatoes. A moderate amount of whole complex carbohydrates. So whole grains, beans, legumes, root vegetables, and a small amount of nuts and seeds. Avocado, flaxseed, walnuts, things like that. So if that would be the number one thing that I would recommend people change.
Mm-hmm. Now, if they're already eating a pretty much plant-centered diet with very minimal amounts of processed food, if we do see a lot of vegans that come into the clinic, and just because they're eating a vegan diet doesn't mean they're any healthier. In fact, a lot of the vegans are overweight, and they have just as many problems as the non-vegans, mm-hmm.
Because bad food is bad food. So if they're already eating a pretty whole foods, plant-centered diet,
mm-hmm.
then we look at some other things. We look at, what are your sleep patterns? Are you going to sleep at 11, 12 o'clock every night, or are you getting to bed by 9 o'clock and getting, 3 really good hours of sleep before the hormones start to kick in? Recuperation hormones start to kick in during the nighttime. Are you rested in the morning? Are you drinking caffeine in the morning, and is that where you're getting your energy from? Are you living on your emergency battery?
Mm-hmm.
So we take a really close look at sleep patterns, and the number one thing to do would just be take a week and set your alarm for 10 p.m. and when that alarm goes off, you should be preparing to, get under the covers and go to sleep.
Yeah.
The other thing that we look at besides sleep patterns is going to be sun exposure. Even though we live on an island and there's sun everywhere and people should be able to get enough sun,
yeah.
They don't. They're inside. They work inside. They sleep inside. They eat inside. They do exercise inside. Everything's still inside.
Mm-hmm.
So if you're not spending 20 or 30 minutes outside with your skin exposed to the sun, then I think your health is going to suffer because of that.
Mm-hmm.
And it doesn't take very much. 20, 30 minutes a day, you can walk outside. You can eat your lunch outside. You can, you can roll down the windows in your car, and get some sun in there. But make sure you have the skin exposed. So you can't be wearing sweaters and a hat and just showing your hands and your feet. That doesn't work.
Yeah.
You gotta get the skin out there. You wear something thin, like a cotton T-shirt, something where the sun can get to your skin and your skin can get some sort of exposure.
Mm-hmm.
Not only does that stimulate, as you know, the production of vitamin D, but there's also so many hormonal benefits as far as the glands in your brain and the neurology just from sitting in the sun and being outside, breathing the real air. So those are the 3 main things that I would suggest people can do right away.
Mm-hmm.
You don't need to see a physician to start eating more fruits and vegetables. You don't need to see a physician, to get outside more.
Mm-hmm.
And the other thing would be rest.
Yeah.
If you're not sleeping enough and you're not really taking time during the day to rest,
mm-hmm.
Then our bodies only really have a battery that lasts for the day. And at the end of the day, the battery should be drained and you should go to sleep. That's what fatigue is. Fatigue is telling you, hey, man, you don't have any energy.
Mm-hmm.
Your battery is drained. Get in bed, go to sleep, recharge the battery. But if we don't sleep enough, then we start the next day out with less battery than we had. And so now we feel tired and we're more likely to look for other stimulants like caffeine and other types of foods that give us the same type of stimulation that will a central nervous system stimulant like caffeine does.
Yeah, it's a vicious cycle then, yeah. So I usually like to ask this in the beginning, but I'm really interested in how people get into their particular fields and their particular interests. So I'm curious how you came down this path of the fasting and the wellness.
All right. Well, as you know, I'm a chiropractor.
Mm-hmm.
I graduated from Life University, and I was in practice for, I don't know, a year. I was in practice for about a year.
Mm-hmm.
And I was seeing patients, it was a typical cash chiropractic office. We just did it. We took x-rays and we adjusted, and that was, we did some education, and that was it.
Mm-hmm.
You came in, you got adjusted, and you left. And I was seeing a lot of patients. Pretty much everybody that came in had some sort of complicating disease.
Mm-hmm.
Those diseases that we talked about earlier, the ones that we spend most of our time dealing with, the hypertension, the type 2 diabetes, prostate cancer, ovarian, uterine cancer, even lung cancer, and colon cancer.
Yeah.
And they have arthritis, they have intestinal problems, they have issues.
Mm-hmm.
And I would only really see small benefits from the chiropractic care that I was doing.
Mm-hmm.
And so that got me thinking, because as you know, we learn in school that patients get high blood pressure and heart disease and diabetes and cancer and autoimmune conditions, and there is no reversing those conditions, and you have to manage them, and the management is with medications, and you take those medications for the rest of your life, and you never really get any better. Most of the time you get worse, and it's just a steady slide to the bottom.
Mm-hmm.
And so I remembered that in chiropractic school we had a nutrition teacher who, his name is Dr. Paul Goldberg.
Yep.
And he would talk about, and had many cases of, a lot of these chronic disease cases, like high blood pressure and diabetes, but also multiple sclerosis and various types of autoimmune conditions. And we got to see before and after photos and before and after lab results, and we actually saw those patients getting better.
Mm-hmm.
And so I was kind of interested in, what are you doing?
Mm-hmm.
What are you really doing? Because it was clear he wasn't prescribing meds, but it was also clear that he wasn't really doing adjusting.
Yeah.
He wasn't doing, conventional chiropractic care. So I went to him and I said, well, I want to know what you're doing, and how can I figure that out? And he had at the time, he had an associate, I guess. Dr. Dave Tenner was his associate at that time. He had just graduated school. He's around my age. And he said, I don't have room for you. And I said, all right, great. So where do I go? And he said, well, go out to True North Health Center in Santa Rosa, California, and you can see a little bit about what they're doing out there.
Mm-hmm.
Santa Rosa Health, True North is another residential health and education center where they specialize in medically supervised fasting. It's a very large center. And so I called up the founder there, and I went out, and I actually ended up doing 6 months, and then I did another 6 months of interning on it's like a compound. It's like a compound with all these apartments, and about half the patients are fasting and half of them are feeding. And there's medical doctors and nurses and a bunch of chiropractors and naturopaths and natural medicine physicians. And so I really got to see people get better. Mm-hmm. If you stay and watch people over the course, every day, 2 times a day over the course of 3 to 6 months, you're taking vitals on them every day. You do lab tests every week. You're taking their urine every week. You actually get to see not only them physically change, but also the lab results change dramatically.
Yeah.
And some of these conditions just disappear within weeks. And after seeing that, there was really nothing else that I could do. I mean, after seeing changes like that,
Yeah.
that was it. So I stayed there for about a year, and then my wife is also a chiropractor. She is a co-founder of the clinic with me.
Okay.
And she and I both decided that we wanted to have, to bring this type of work to a different part of the world. And she's Puerto Rican, so we ended up here, and there's just millions of people, and the chronic disease rates are even higher than they are in America. Because you combine the American terrible diet with the Puerto Rican terrible diet, and you get like a fried, salted pig fat. This is not a healthy diet.
Yeah.
And so we set up our center here. We've been in business. We've been open for a few years now. And now we get to see those same changes every day. Every time we go in to take vitals, every week when we go to the laboratory test to test patients' blood, every time we go, we get to see all those positive changes. And patients are so grateful that they finally found out, what works, which basically is just addressing the cause of the issue. Because they've already been through the medical route, they've done the supplement route, and the basic premise behind medicine and giving chemicals is that we're trying to create some secondary disease to cure the primary disease, and that inherently doesn't make any sense. So we just avoid all of that, try and find out the causative factors in patients' problems, and if they're a good candidate for fasting, then we fast them and watch them get better. And I really enjoy what we do here. It's just so fun to see people change.
Yeah. And I remember going through Dr. Goldberg's class too, and being fascinated by this type of work, and it excites me that you're doing the same type of good work down in Puerto Rico and helping the population down there. Absolutely. But I think we're just about out of time, Dr. Frey. Did you have any final words for our listeners or viewers?
Fasting is more beneficial. We're going to find that fasting is more beneficial for healthy people. So fasting does great for a lot of different types of conditions, but really it's about maintaining health, and chiropractic is really about maintaining health. And so we think that goes right along lines with basic chiropractic principles, that the body does maintain itself, and you just need to give it what it needs. And sometimes it just needs a break, and sometimes that break just means taking a break physically and mentally, but also to the whole organ system that does all your digestion and assimilation. Just turn that off for a little bit, give it some time, and then when you turn the computer back on again, a lot of these things that were troubling you before, they're not there anymore. But I actually enjoy seeing patients who are healthy. It's fantastic to see someone coming in on a yearly or biannually basis to take a week off from life, get back on a healthy diet, and sort of reboot their system. And in the future, when everybody does understand what a healthy diet is and does do more healthy things, and we don't have so much disease, then we'd still be using fasting to maintain health. So that would kind of be my closing. And if anybody is interested in any information on fasting, but also on healthy dietary habits and other health information in general, our website is full of information. We have over 200 or 300 videos. Some of them are in English. All the videos that I do are in English. All the videos that my wife does, they're all in Spanish. But if you guys are interested in learning more about fasting, but also about a healthy lifestyle, then get on the website. It's backtothegardenpr.com. That's backtothegardenpr, like Back to the Future, but Back to the Garden. PR for Puerto Rico.
Perfect. And if anyone wanted to get a hold of you in your clinic, or how would they do that?
Well,
Just
we do phone consults. Everybody who comes to fast, we do a really detailed history and analyze laboratory tests, and we can do all that over the phone and through email. But the first place to go would definitely be the website.
Okay. And Puerto Rico would not be a bad place to take 7 to 14 days to rest.
No, it's gorgeous.
Yeah.
I mean, people come here all the time and don't fast, and it's one of the reasons that we decided to set up down here. Is the weather is fantastic, the fresh air, the environment. You got the ocean right there, but you also got the mountains. It's beautiful everywhere, and you can certainly take some time off after your fast to do some touristic stuff.
Absolutely. Well, it's been my pleasure getting the chance to interview you, Dr. Frey. I appreciate you taking the time out of your busy schedule to talk to me and share your wisdom with our listeners. And then this has been your host from the Neuro Wellness Podcast, Dr. Kappas. Be well.